Health Services. I myself, I'm one of the presenters. My name is Lene. This is actually the first time doing large presentation in a hot minute because of COVID. But it's really nice to know you all. Anyways, thank you so much for being here. I know it's probably after lunch, you know, a little groggy and tired, but this is how it's gonna go. I'm gonna give a little presentation because I'm sure you have plenty of questions about the things that we do, the services that we provide. But I'll be going over a little PowerPoint, and then my colleague over here, Kristen, will be answering some questions. Kristen, would you like to introduce yourself?
Hey everybody, I'm Kristen Charlie, Dr. Kristen Charlie. I am the chair of health promotion at the university. And there is administrative overseer of all so we are kind of the prevention side of services for the emergency son, my daughter, and doctor, kids, overall health and then also to speak a little bit more about the clinic side of sharing and support.
Another fun, interesting fact about Kristen, she has two cakey that are well, they're not cakey anymore, they're adults. They are actually attending the beach as well. And so she's also the parent of a student. So we're excited. Great. Okay, so we have two different branches of health services. We have our clinic, and our clinic is going to be located on East West Road, right next to our Kennedy Theater. Now, when we come to our clinic, we do have a full service clinic. It's not an emergency room, and we do have some limits on what we can provide, like emergency services. There is a student that comes on with emergency needs, we'll be able to call them an ambulance and get them to the right care that they do need. But these are some of our services that we do have. Now, again, general clinic needs, so if someone's sick, they're not feeling well, they're more than welcome to come in to see our one of our physicians. We also offer dermatology, we have a great lab, and so if someone does get tested, they get tested right at our clinic, and we also will be able to give them results as well. We also have a pharmacy that we have prescription medication, over-the-counter medication as well at a lower cost. So if your student doesn't want to go to Longs or what we call CVS, Longs here, and they just want to get like an allergy medicine, we do offer that at a lower cost at our pharmacy. We have psychiatry as well, and for psychiatrists does prescribe medication. We have really well-trained specialists that does sports medicine and well-being care. So they can come in for routine checkups, and also prevention and family planning as well. Like I mentioned about our pharmacy, again, it's a really great service that we provide. You might notice that your students have some allergies, and they're, oh my goodness, I'm sick all the time. So go to our clinic, go get some low-cost allergy medicine, and that, again, that's the service that's provided. One thing though about our pharmacy, if your student does come to our campus having a prescription ready from our primary care provider, we won't be able to transfer those medications, and so what they're going to have to do is make an appointment, which you're going to go online, and speak with one of our providers, and they'll be able to prescribe the prescription that they can need, and then they have other medication management for their home. They said you can book appointments online. I won't go through the whole process of it. It's an easy and fairly short process to book appointments online. Again, you just go to our website, which is notified to remember, www.hawaii.edu/SHS to health services. When you put that online, there's a tab there, which is all the instructions that are provided.
We do take walkies. So, for example, I love appointments. You know, we had someone who wants to see the dermatologist. That's great. And they know every single
But if someone falls off the stage before the trips over the stairs and has a they walk right in. So we take everybody, but for non-emergency,
Yeah, really some people don't skateboard down those long hills, but they still do. They still think our clinic. So please have them come to us. But we love those appointments. So if they're able to, book those appointments online.
I gotta, like,
Okay, I know this is a trigger word, COVID-19 prevention, but gotta talk about it. And so there is still a requirement for masks on our campus. You know, things do change throughout the semester, so what I tell you today will be changing the next 3 months, 4 months,
So
at the end of that academic year as well. So
so
we like to tell our students, check your emails because most of the time, these changes are going to be coming from the office of the president's office. And they'll give you the exact requirements that's required for a mask on campus. So I think you have the most up-to-date requirement though.
Well, we were just, as we were getting ready to talk to you, we were saying, you know, what can we do?
Because then you get
When in
like I
doubt,
look back like so like when they added on the semester after, like on my side where they have
We
29
know that if we're teaching in class now,
as it's
faculty members, as long as they're a good distance away
Yeah, so,
from
like,
the students,
mhm.
can actually take
I got like priority registration. Like because I was like so that class literally is like 12 credits is almost a whole semester of classes. Like you know what I'm saying? So it's literally raising up registration back to
if your student goes for rising and there's that, you know, small office space, the advisors are going to so interesting. So, and in our clinic, and this will probably go for
my roommate last year, she
move
was in
into the
Norway,
clinic area.
and so she spoke to
That's like, yes, that's not
and we don't have a Norwegian professor, so no one could prove that she spoke Norwegian. So like, she really
one of the
was
things too,
hired.
when I'm thinking about
They
the
didn't
first
really both
visit
walk through
that
mud.
your student
We have to.
mine had to bring their insurance card. They don't always have to bring their insurance card. Once we've got it in the
Oh
system.
yeah, nobody told me
just
go
walk
to the
right
card
in
right
and
there.
pick them up. We have that on, they're good to go. And they have HMSA, they have an insurance plan. The first time we lost that in.
I should have waited until it was all the way out of the doorway.
Thank you. When in doubt, just call the clinic. The clinic will be able to answer those questions too. Okay, so we also have really great after hours parents advice line. So our clinic is not 24 hours. It's only open Monday through Fridays, 8 a.m. to 4 p.m. Closed on state holidays, which is tomorrow. So today's on Friday. So after hours, please call the nurse advice line. So let's say someone did fall off their skateboard and they notice that their ankle is starting to swell because of that. And then the clinic is closed, they can't go to the clinic. So they call the nurse advice line, they give them advice. And maybe the advice for them is to add the biggest advice on it and go to the clinic the next day. And so that way they don't have to rush to the emergency room. It's another service we provide for our students. That way we can help maintain them. That way we can help support their wellness if we are privately injured. Or if we are extremely injured, the nurse will tell them great care.
But it's worth it to take a place to test if you know you're gonna pass it.
Again, all this information is on our website. So if I was talking too fast and not being too hard, again, go to our website. It's going to have all this information on there. So there's student health insurance, but this student health insurance is not sponsored by the institution itself. So it's not University of Hawaii health insurance. It's health insurance sponsored by HMSA, which is also known as Blue Cross Blue Shield. But HMSA is a provider that provides student health insurance at a rate only for students who are attending University of Hawaii. Again, that more of that information is in the online, if you're interested. It goes by semester. And there's different plans they have. That's just medical insurance, medical dental, and they have different rates that we can select which rates you want. Our deadlines, I don't have a deadline on my mind right now, but again, it's on our website, and we do provide, HMSA does provide a student health plan. And the health plan is going to be accepted at our clinic. We do offer, our clinic does usually accept majority
Right?
of insurance, but there are some that do not, that we don't accept. I am alumni of UH, so a Kaiser member, and so when I was a student here, my insurance wasn't accepted at the clinic. So we don't accept Kaiser, and we try to as well at our
That's
clinic.
what they were talking about.
And if your student is a Kaiser member, they can
That
provide
she
it,
came up and she was
because
asking us,
the
so
one,
she's
or
like,
the
she's
clinic,
losing stuff.
or Kaiser clinic is
And
very
so
close
she
to
came up and
campus.
asked us.
But just a heads up,
For police about
if you want to be able to know what
We're just
insurance
doing
providers
the
are accepted at our clinic, them a call or and then
It's
if
really
they're not
easy.
accepted
That's
by
right on my
students
phone
who
right now.
wants to come to our clinic, we will still see that student.
You literally
And
stand
so if
there
it's something that's
smiling.
urgent, again, find out that's meeting or something that I know we're gonna see this year, which is like we're going back to it. We want them to come to us because it's urgent. And then we additionally send them out to an emergency hospital.
Well, last year I didn't actually go because I had class. But we had like Instagram reels and stuff, so we could do it instead, or like other tasks and basically made up for it. It was never got it done. Yeah, it probably looks so nice.
Maybe that is what the office would like, additional age students, especially our graduate student population until we don't need, just go to the ER, come to us.
Now we can talk about health promotions. So the clinic, they treat our students and make sure that they're good, but over at health promotions, we do preventions. We want to make sure that we're able to prevent unhealthy things from happening and mental illness on our campus. So these are some of the programs that we provide at health promotions. Because we talked about what I do with basics. So basics is
I just got a real marketing grade 11 this morning.
Their basics is pretty much healthy to help screen and intervene for students who are having issues with alcohol and other substances. And so we don't do treatment for that. What we do is that we, again, screen, intervene, and refer out if necessary. But most of the time, the students that I do see don't need that extra step. They just kind of need to understand where they're at in the usage, how to lower their risk, and ways to help them to get that balance and reduce that risk of alcohol usage and do that goal settings. Because our goals, we just want to make sure that they're happy, that they're healthy, that they graduate. And then if alcohol is part of that, or other substances are part of that, making sure that they understand the risk so they can make their own choices in those challenges. We also have the Malama Project. The Malama Project are for students who are in recovery from substances. So the Malama Project is not there to replace those forms of recovery and AA and what we are, we're there to enhance it because students are in college and
You have to live it in the office. My marketing department had it.
again,
Do I take marketing 311, which is like separate? And no, I marketing from this
and then the No Alcohol Project is more of a passive program. This is based off the social practices, posters around campus. I just want to let you know, the majority of our students are making healthy decisions when it does come to alcohol and other substances. And these posters show that. And by showing that, what it does is it does join us as choices. Those are a couple of the programs that we have. We also have something called 101. So please encourage your student to. You know now? I'm going to hear you this whole time. Okay. So if your student hasn't already, which they probably haven't because this is the first time we're seeing it, okay, let's go. So the Health 101 is a student health online magazine. Please have them subscribe to it. There's going to be really great information about wellness on campus, how to not get that freshman 15, weight gain your first year, and again, ways to help make healthy choices. And also they subscribe so they are put in a drawing to win prizes. Okay, so we're wrapping this up because we're going to get to the Q&A. As a reminder, no smoking on campus. We are a smoke-free campus. That includes electronic cigarettes and traditional cigarettes. And then if you could follow us on social media to have the most updated information about the programs that we're doing. You'll see us around campus, do health fairs, and other fun stuff. So if you want to see what we're doing, follow us on the IG, the Twitter, and the Facebook. Okay, so let's get to the Q&A. All right, Chris, I'm going to pass this to you.
The HMSA plan, if it's the student health plan, is super comprehensive and should cover for all the medical, you mentioned the medical and there's also the option for medical and dental. There's also an option. The only thing I could think of when I hear what your question is, there might be an issue with repatriation insurance for internationals. Okay, great. Sure. Absolutely. So this would be my suggestion then, and we can actually, if you like, I can help just a little bit even after this, because I can give a call over to the clinic. Probably the best thing to do is from here, the clinic is about a 3 or 4 minute walk, is we'll just let them know you're coming, and we can just have to go right to the front desk and have them clear it out. Thank you, that's a great point, because we want everyone to be able to start on Monday, for sure. Okay, well then that's something we definitely, we'll make that work. Yeah. It's all about supporting each other. And like you mentioned, because I have the 2 kids, I have 3 kids, but I have one who's a senior and one who's starting on Monday. So it doesn't matter, even though I've got one almost out of the chute, I'm still nervous. Okay, I'm here, that's parents. Okay, thank you. Okay, that can be up, that's a good question too, and that's probably another piece of information that could be given either through the student's portal, because they'll have a portal which they create their account, or even a good thing to talk to the front desk about. And that also goes for, this is not exactly the same issue, but it maybe pertains to everybody in the room. Because your student is protected by HIPAA and FERPA because they're considered young adults, it doesn't mean that information can't be shared with mom and dad, but they're going to have to sign a release. So it's a little bit related, roughly related to the power of attorney, but it goes back to that idea of if you want to be able to share information with the clinic, then that student should be working with you to have that release signed. And that would also be uploaded into their portal. Great question. Yes. Okay. So the student health fee gets, you're so sweet. Okay, thank you. So the student health fee provides your students with a lot of different things. Coming out of COVID over the last couple of years, the student health fee helped to fund and support the COVID response team, which was the public health outreach that occurred on this campus to keep everybody safe. So it has to do with overall campus wellness and safety. It also has to do with all the prevention education programming that occurs. And it also helps offset some of the costs of the clinic itself. So it actually provides resources for overall health and well-being across the campus community, and it also helps with some of the services within the clinic itself. The counseling too, yeah, thank you. Yeah, it also helps support our counseling center too, thank you. Yeah, so all of those services that would be like a non-billable service falls under the health fee. Yeah, great question.
For those students that are double covered, will you bill both insurances, or do they just need to have their primary on file?
They can actually have both on file, but if that's a need, there may be some individuals where that's a need where they need to use both, so both could be on file. Yeah, it's a great question. I see Wade there. This is newly renovated.
So we don't have Kaiser, but we have an HMO from California that covers emergent and urgent care. I tried to go on and pay the $1,600 for the HSMA insurance. right? And one of the first questions says, see if you're eligible. And one of the first questions to see if you're eligible is, are you a permanent resident of Hawaii? And he's not. He's a permanent resident of California. So I don't, and it wouldn't let you go past that. So do I say he is a permanent resident of Hawaii as a student and pay the $1,600? Or when he comes in November because he might have a cold virus that needs an antibiotic, I don't want to get a $1,000 bill because you gave him Keflex and saw him and made him my HMO from. So,
Okay, so I'm hearing a couple different things, and then, so it's a great question, and it may be applicable in the way you answer it to everyone else too. If it's the HMSA student plan sponsored by the University of Hawaii, that is open to all students, whether you're a state resident, whether you're an international student, whether you're from the continent, you come from Vermont, let's say. There is no restrictions on the university's plan. So when I hear they're asking and then maybe restricting, that makes me think that it might not be the HMSA university plan. That might be the hiccup there, because there is no restriction. It's for university system students, not even just Manoa, but any of the CCs. So that's what I'm hearing. So I think if it's going to the HMSA site and selecting the university's plan, you should be good to go. And you can do that off the Health Services website. But the other thing I want to let everyone else know is if for some reason, going back to Kaiser, there's nothing wrong with Kaiser. And we have a clinic that's close to our campus that's Kaiser. But still, in that moment where the student has a very sore throat and they just want to be seen, it is still very low cost to come in and get service as a non-insured student. So I stress that because I don't want anyone to go without care just because, they don't take my insurance. Because we'll always take the student. And I think, again, when it comes back to emergencies, we'd rather just help someone, and then we'll worry about the other part later, if someone is in need of health care that afternoon. Okay, great question. So our clinical staff is, we have physicians that are either full-time or half-time. So if on any given morning or afternoon, you're going to have 3 or 4 physicians on point. They're actually working. And then we also have nurse practitioner who does our women's health clinic, and then we have RNs too. So we're a really full staff. We're kind of busting out at the seams when it comes to our physicians and our nurses, which is great. So that's why in some ways when we look at our data, the wait time for students is 10 minutes or less because we're pretty full staffed. So that's the nice thing about Manoa. We have a fully functioning clinic. Okay.
Thank you. I'm so sorry. I do have to cut off the questions, but if you do have any lingering questions, please email those questions to us at healthed@hawaii.edu. I'll also be saying that over here. If anybody wants to kind of hang out and ask any questions if they're not going to their next session. Thank you so much for having us, and welcome to Manoa.